go off and create yourself one. If you're not a whiz, you are welcome to purchase the one that we have. But, you know, some people are very good at building their own, or maybe you've already got one. So I categorize it, everything we've talked about there in getting ready, we have here, because this is our oversight. This is us looking at it from a helicopter view. This is us having aggregated all of the data. So we go to one place and we can see dates and risk levels, you know, client prioritization matrix, for example, which speaks to what is the dependency that this person has on our organization, so that we know at a moment's glance who is the most dependent. Therefore, in an emergency, who would we worry about most? You know, that's fine when you've got 5 people, you know who is the most dependent, but it's not scalable when it's in your mind. Scaling your organization for success is about making sure that you can do it with 5. You can do it with 100, or you might have 150 clients. So we need, you know, you can't remember 150 clients. That's just not possible. So we have a client service prioritization matrix, which is very risk-based, our normal participant risk, which, remember I said, being able to have a moment's glance at what the level of risk for a person is and what their due date for renewal of their review of their risk was. We need to demonstrate that we've got that in hand, that we're doing that we've got it all under control. Other important things, there wouldn't be any of you, I'm sure, that wouldn't have a risk register. So there's an example of a corporate risk register. That's business risk. So that's not people risk, that's business risk. We have things like trying to better manage the complex care by nutting that out. People who have multiple medications, oral health review, being able to, when you've got a SIL service, being able to record when somebody's dental appointment's due again, etc. Dates for renewal for CHAPS, conflict of interest, all the usual suspects, I suppose you'd say, as well as, you know, the dates policies are meant to be reviewed, the dates of your insurances when they're due, because and vehicles, your complaints, so that you can look back and be able to analyze for trends and things like that. And we've got our HR tool as well, which records all of the what's the word? Records, you know, things like, these are the dates that are important here. When does their APRA expire? When does their working with children expire? Now, I know that Brevity does that. So if you've got that sewn up, excellent, that's fantastic. But if you don't have a software system, you do need some way to be able to show that you are monitoring and managing, you know, the review and renewals, you know, of all of these things. And I think we can go 5 minutes over if nobody has to go, because I made you wait for 5 minutes. Things like your incident register, for example. I found most people didn't know how to do, you know, 4 or 5 years ago, people weren't even aware how to manage an incident. So the entire register was designed not just as an oversight tool to show when something had been completed, but it also has the processes that are embedded in the incident rules. So this is what's required. If you followed this register, you could be sure that you are doing what is required of you. Of course, it also would have a form that backs that up as well. But this speaks to the requirement for oversight of incidents, oversight of complaints, oversight of HR matters such as the staff checks and their registrations and your insurances, etc., etc. So that's just a snapshot. So I think I've got a question here. Yes, you can purchase it. It's always on my website, a compliance management system. I'll pop a link in there for you if you like, and I'm sure you'll love it. Everyone does. We all love it. And as I say, like, we're working really hard to get the software system built so essentially will be turning all of this into a software, which I'm really excited about. So I just want to make things easier and make it really pleasant for people to do, because I think when it's pleasant and easy, people will do things. That's my philosophy anyway. Any questions, anyone? Are there any sort of unusual questions, like questions around your own audit or anything? Now's the time to ask. Anything you want to ask is fine.
Is this a new register, or can I use the same one that I purchased last year?
It is the same one. There might be some updates. So if you purchased one last year, if you just email me, we'll just send you an update. And all you would need to do is move over any new registers that you don't have now. Just move them onto the one you've got. But send me an email if you would, in the subject line, just put, compliance register in it. So yeah, we definitely update you on that.
Wonderful, thank you.
That's okay. Any other questions about your upcoming audits? I love talking about audit. Would you know how long registration is taking? You mean after you've had your audit report submitted? Anywhere from 3 months to 2 years, which is horrific, isn't it? Horrific. So if you're a behaviour support practitioner, you'll get through a little bit quicker because they're in absolute dire straits for behaviour support practitioners. But otherwise, I've got clients coming to me that we took through registration 18 months ago, yet somebody else gets registered in 6 months. So there's obviously some rhyme or reason, but we're not privy to the rhyme and reason for that. Because of the checks that the Commission do, it could be anything. It could be that, how do I know where somebody's come from in a different country, what happened there? I don't know. I just know that they don't give answers and they don't get held to account for any timings. Any other questions? Like, is there anyone here worried about their audit and want to ask anything? You all sound very confident then. That's wonderful. Well, what I'll do is I'll send this out with your checklist. And if there's no more questions, I guess we can sign off. Alrighty. One more opportunity to ask a question.
Gina, can you hear me there?
I can.
Oh, sorry. If you're If you're registering as an individual, as a counsellor or something like that, yep, you wouldn't need as many documents or anything like that, would you? Because you'd be.
So you're going verification. Is that what you want to do?
Yes.
Yep. So no, you don't. The ones that you'd need would be just you want the human resources, you want yep, the corporate risk, you want, because there are 4 things: human resources, risk, complaints, and incidents. So you really only need those 4.
Okay.
Yep, we actually have a register that is cut down, which is designed for verification. So this one is definitely for certification, but we have a register that is for verification clients, so it's much less on it.
Is the audit the same cost as?
No, much less, much less. So you'll get that audit anywhere from, if you're lucky, from $900, or if you went to Sci Global or somebody equally as expensive, you could pay $2,500 or $3,000. So anywhere from $800 to $3,000. I would steer clear from Sci Global because I think they're far too expensive.
Yeah.
Way too expensive. I mean, their average cost for certification audits is $10,000. Most other organizations are charging, you know, around 3,500 to 6,500. I just think every cent counts.
Yeah.
Yeah, that's their name doesn't do it for me. I don't think their name is worth 3 times the amount. Do you have an audit checklist for the 18-month audit? Okay, so let me tell you about, here's a good one. Let me tell you about the midterm audit. Yes, it is only Division 2, but let me tell you what happens. One thing's wrong in your Division 2. Let's say they do a sample of files, and I know that they're only coming in there to do Division 2, right? Which is what we talked about, all of those compliance obligations that we want oversight for. But what happens is, and it happens all the time, and I get people coming to me because I've met them for the first time because they've come to me with a 90-day review cycle, because they've opened up their files and they found that all the things I've talked about, like doing your staff files, doing your participant files, because they found so many non-conformities in that, because people thought they were only coming to do Division 2. And they are coming to do Division 2, except they do file samples, okay? And when they go file sample, then they start going into everything. So not only were they, because, you know, you go into the file and they look at incidents, the incident's not done correctly, major non-conformity. You didn't expect that, did you? Because you thought they're only coming in to do Division 2, only coming in to do my governance. No, this one guy thought exactly the same thing. No, as soon as they go in there, and if they see something wrong in your file, that's it. They're down the other pathways. They're down rabbit holes. Okay, so don't be fooled into thinking that just because it's a Division 2 governance audit that they can't and they won't look at other things, because what they see can lead them on to the next thing and the next thing and the next thing. So some of the worst 90-day audits came from a midterm audit. Some of the very worst. Recertification, well, that's just like a big one. Yep. So expect, so really based on you want to cover off everything. So you want, my suggestion to you is to always have an internal audit. And if you did, I mean, it's not that easy to do. It's not that easy. It takes years to learn the standards and how to interpret them and what it means in practice. And my suggestion to you is spend the money to have an internal audit, and you will have saved your own time in doing it, all the sleepless nights, all the staff that you would have needed to allocate it. I think it will have cost you just as much to do it yourself as it will to get an internal auditor in to do it for you. And not only will you have that internal audit done with a list of everything that's wrong and how to fix it, you'll also have automatically, that is a quality action plan. Yeah. So it's just better. It's money well spent. Okay. So re-registration is recertification. So the same thing. So that's a big one. They will go through everything. So they'll go through everything that you're registered for, whereas your midterm is supposed to just look at Division 2. But I've just given you an example of what happens to people when they have a Division 2 and they are nowhere near, because they just thought they're only going to look at my governance. But they forget complaints and incidents and quality and all of those things. They're all tied up in what you did with your clients. So they go into their files and they just found everything wrong. And please don't be fooled by that. And also midterm audits are getting very strict now, because I guess what they've been finding, you know, in midterm audits, maybe they're sort of realizing that people are not really understanding what Division 2 is, and if they did, they probably would have fixed all the other things as well. I mean, I can't really do their thinking for them, but you know, please don't think that they can't see other things if they only coming to do Division 2, because Division 2 is the head on the octopus. So if you think about it, you've got Division 1, rights and responsibilities, Division 2, which is midterm audit, which is governance, and you've got Division 3, which is the support environment, and then Division 4, which is, the support environment and the support provision environment, sorry. So there's your 4 divisions in the core, right? And midterm, they're kidding you into thinking that, you know, we're just coming to do governance. Governance is everything. It's everything. It constitutes everything else in those core, because as a drill down to that, as a drill down to complaints and incidents, etc., and risk, all those other divisions are included in that. So it's kind of they're not really just doing governance, they're doing everything, but they focus on governance as their way in. Yeah. So best thing to do is internal audit. And you will learn so much from it too. So, and less headache and less stress. And we all like less stress, don't we? All right. Any more questions? Well, if you do end up having any more questions, you know where to find me, don't you? Does anyone not know where to find me? Oh, just in case, I'll put my email in here, and I do love audit questions. The only question that's a silly question is the one you didn't ask. So, okay, good. I'm glad it was helpful, Roxanne. Thank you for being my co-host. Anyway, this will come out to you as a recording. So just follow the checklist, and I'll thank you all for coming. Enjoy the rest of your afternoon.
Thank you.
Thanks so much.
Thank
Thank you.
No worries. Bye-bye.